In today's world, access to immediate medical care isn't always guaranteed. Natural disasters, remote travel, or even unforeseen circumstances can delay or prevent access to healthcare facilities. In these situations, an emergency antibiotic kit can be a lifesaver. Bacterial infections can quickly become serious if left untreated. Having a readily available supply of antibiotics can prevent complications and potentially save lives when professional medical help is not readily accessible. This essay will explore the importance of having an emergency antibiotic kit, outlining its essential components, proper usage, and legal considerations. We will also discuss antibiotic resistance and alternative treatments. Preparing for medical emergencies is crucial for ensuring your well-being and the safety of your loved ones. This comprehensive guide will equip you with the knowledge and resources to effectively manage such situations. Bacterial infections can escalate rapidly, especially in situations where immediate medical attention is unavailable. Quick access to antibiotics can significantly reduce the severity of the illness and prevent long-term complications. When traveling to remote areas with limited healthcare infrastructure, an emergency antibiotic kit becomes indispensable. It empowers individuals to address unexpected infections promptly and effectively. Natural disasters can disrupt access to hospitals and clinics, making it challenging to receive timely medical care. An emergency antibiotic kit bridges this gap, providing essential treatment until professional help arrives. Early intervention with antibiotics is particularly crucial for vulnerable populations, such as children and the elderly, who are more susceptible to severe complications from bacterial infections. Having an emergency kit readily available can be life-saving in these situations. A comprehensive emergency antibiotic kit should include broad-spectrum antibiotics like amoxicillin, doxycycline, and ciprofloxacin. These medications cover a wide range of common bacterial infections. Antiseptics such as hydrogen peroxide and povidone iodine are vital for cleaning wounds and preventing infections. Topical antibiotic ointments like neosporin or bacitracin aid in the healing process. Pain relievers and anti-inflammatory medications like ibuprofen or acetaminophen help manage pain and fever associated with infections. Oral rehydration salts, or ORS, are essential for preventing dehydration, particularly in cases of diarrhea or vomiting. A basic first aid kit containing bandages, gauze, sterile gloves, scissors, tweezers, and a thermometer should also be included. These supplies are essential for wound care and monitoring vital signs. Proper storage is crucial to maintaining the effectiveness of the antibiotics in your kit. Store the kit in a cool, dry place away from direct sunlight and excessive heat or humidity. Regularly inspect the kit and replace any expired medications promptly. Check expiration dates at least every 6 months to ensure that all medications are still potent. Keep the kit out of reach of children and pets. Store it in a secure location to prevent accidental ingestion or misuse of the medications. Clearly label all medications and include detailed dosage instructions for each antibiotic. This ensures safe and appropriate usage in emergency situations. Section 5. Usage Guidelines and Legal Considerations. Familiarize yourself with the recommended dosages for each antibiotic included in the kit. Consult a healthcare professional or pharmacist for guidance on appropriate dosages for different age groups and conditions. It's essential to understand the symptoms of common infections and when antibiotics are necessary. Antibiotics are only effective against bacterial infections, not viral infections like the common cold or flu. Obtain antibiotics legally through a licensed healthcare provider. Keep records of your prescriptions and ensure that you're using the medications responsibly and within legal guidelines. Consult a healthcare professional before administering antibiotics, especially if symptoms are severe, persistent, or if you are unsure about the diagnosis. This ensures appropriate treatment and minimizes the risk of complications. Section 6. Antibiotic resistance. A growing concern. The overuse and misuse of antibiotics contribute to the growing problem of antibiotic resistance. When bacteria become resistant to antibiotics, infections become much harder to treat, leading to potentially serious health consequences. Use antibiotics only when necessary and as prescribed by a healthcare professional. Never self-medicate or share antibiotics with others. Complete the full course of antibiotics, even if symptoms improve, to prevent the development of resistance. Practice preventive measures such as frequent hand washing, proper wound care, and vaccinations to reduce the risk of infections in the first place. This minimizes the need for antibiotics and helps preserve their effectiveness. Support public health initiatives aimed at combating antibiotic resistance. Educate yourself and others about the responsible use of antibiotics and the importance of preventing infections. Section 7. Alternative treatments and identifying infections. While antibiotics are crucial for treating bacterial infections, some alternative treatments can be helpful for minor wounds and infections. Honey, for example, has natural antibacterial properties and can be applied topically to minor cuts and burns. It's important to differentiate between viral and bacterial infections. Antibiotics are only effective against bacterial infections. Viral infections, such as the common cold or flu, are typically self-limiting and resolve on their own. Learn to recognize the signs of bacterial infections, such as fever, chills, redness, swelling, and pus. If you suspect a bacterial infection, consult a healthcare professional for proper diagnosis and treatment. Prebiotics and probiotics can support gut health and boost the immune system, which can help the body fight off infections naturally. Incorporating these into your diet can contribute to overall health and well-being. Section 8. Preparedness and community resources. Prepare mentally and emotionally for medical emergencies by having a plan in place and a support network to rely on. Knowing what to do in a crisis can reduce stress and anxiety. First aid training can equip you with the skills to manage minor injuries and illnesses effectively. CPR and basic life support training can be invaluable in life-threatening situations. Familiarize yourself with community resources such as local clinics, hospitals, and emergency services. Knowing where to seek help in an emergency can save valuable time. Engage in community preparedness initiatives and share resources with your neighbors. Building a strong community support network can enhance resilience in times of crisis. Section 9. Conclusion. Be prepared, stay safe. Having an emergency antibiotic kit is a crucial aspect of preparedness in a world where access to immediate medical care isn't always guaranteed. By understanding the importance of quick access to antibiotics, knowing the essential components of a kit and following proper usage guidelines, you can be better equipped to handle medical emergencies effectively. Remember to store your kit properly, be mindful of antibiotic resistance, and explore alternative treatments when appropriate. By prioritizing preparedness and utilizing community resources, you can protect yourself and your loved ones during times of uncertainty. Stay informed, stay prepared, and stay safe. For more technical articles, follow amotecinsights.com.